Good day, everybody. Welcome to this week's Health, Home, and Lifestyle. And I have with me a very special guest, the newest member of the IHP family, Dr. Leslie Filler. Doc, thank you so much for joining us. As the newest member of the IHP family, Doc, could you just give us a little background about what you do and what your profession is?
Sure. So I am a doctor of nursing practice. I have my family nurse practitioner. I have over 14 years of experience in pediatrics. Back home in Idaho and Oregon, where I'm from, I have dealt with pediatrics, urgent care, and family practice for many years, and I enjoy everybody of all ages.
So, Doc, back to your background on pediatrics. I guess what is the most interesting illness that you've come across for a kid? Is it like a rash, like a really bad rash, or maybe something even worse than that?
Um, let's see. As far as an illness, I think that when I first started, I had somebody with what's called HENOC, and it had lots of what we call petechiae, or little bitty dots of purple on them, and they couldn't walk, and I didn't know exactly what to do with them, and so it was very interesting to me to be able to not only help them figure out what it was, but to manage it and get them the care that they needed, and but it was also educational for me.
Right, Doc. I actually did read somewhere that you are also into reproductive health. Could you just expand more on that?
Yes. So in my pediatric practice as well as my family practice, I was involved and have been certified in not only IUDs but Nexplanon and family counseling. And so I offer many different contraceptive options and tell them what their abilities are based upon their family history or their own personal history, and then we go from there. However, my favorite is the Nexplanon, and we're going to be having that coming to IHP very soon.
So, Doc, I hope I say it right. Nexplanon, could you give a bit more detail about what it does and if it's really an effective type of birth control?
Sure. So Nexplanon is actually 99% effective. The only other one to be able to be that much effective is one of like the Paragard IUD, and other than abstinence itself. But Nexplanon goes up in the upper section of the arm, and it's lasts for 3 years, and it's very non-invasive. It's a pretty easy procedure that we can do in office. It takes about 10 to 15 minutes, and as far as for its hormonal based, so it's much like a oral contraceptive, but you don't have to take it every day. It's kind of like set it and forget it. So once it's in, you're good for 3 years. You just have to come in once a year to have it looked at.
All right, Doc. Of course, reproductive health, especially for women, is very important nowadays. But since this is your field of expertise, could you just share why it's so important, especially nowadays for teens and young adults who sort of don't want a baby to stay away from that course of direction?
Okay. Yeah, so as far as for especially for teens and young women maybe who have never had sex, it is always great to be able to come in. I have the privilege of educating them that what their not only what their options are and how to prevent a unwanted pregnancy, but also be able to help teach them about sexually transmitted infections, about urinary tract infections, about many different things that maybe they didn't even think that were possible, and how to prevent them. Not only how to manage, but also treat. And so it's very important for young women to be able to have the knowledge and know that there's options out there and how to utilize that so they don't have any of those, either diseases or unwanted pregnancies.
So, Doc, here at IHP, of course, apart from doing reproductive health stuff, what else will you be doing?
Yeah, so I'll be taking care of, I can take care of anybody from newborn on up to, 100 plus years old. My love is pediatrics and family practice, so I can do annual physicals. I can perform pap smears, so part of the annual physical, order mammograms, colonoscopies. But some of my favorite things to do too are procedures. So procedures like with the Nexplanon, but removal of boils, cysts. I've had some history and some education in dermatology, and also toenail removals. I can do those as well. So there's a kind of a variety that I do, but if anybody's interested, they can always call IHP and they can let them know if I can take care of them or not.
All right, Doc. Well, of course, to sort of wrap everything up, is there anything more you would like to add about, your long experience in healthcare and maybe a little message for the people of Guam, since you are new and you are one of IHP's newest doctors?
Yeah, so I moved here and I plan on being here forever, sold my home and everything. And so I hear that, prevention is one of the keys here on island, because there are a lot of things, some even such as gout. And so I love to educate. And so in order to be able to further your ability to see, a healthcare provider, I'm very easy to be able to get into. You can usually get into me the very next day, if not the same week. And I do work some Saturdays, so it's convenient. And I also work urgent care here too. So as far as a message to them, come on out and, if you see me in public, say hello. And I'm very personable, and it's been great so far being here. And I look forward to being able to take care of the community.
Right, Doc. So, I'm actually very interested. What made you want to sell your home back in Boise to move here to a very hot Guam?
Yes, so I love the fact that it is warm, and I disliked having the snow, and so I wanted someplace that was not only a warm environment, but an island, and I love the beach, I love hiking, but I also wanted to reevaluate my life after being a cancer survivor from colon cancer, and so, every day is not promised, and so you want to live life to the fullest, and so yeah, I wanted to come out here for a long time. My husband grew up in the South Pacific, and it's beautiful, and the people are wonderful.
So, Doc, let's just touch up a little bit on your cancer story. Since you are a cancer survivor, I guess, how did you beat the big C?
Lots of surgery, unfortunately. My type, we couldn't do radiation, couldn't do chemo. It would not have been one of them that you could just do a stool test. I ended up being very, very sick, losing 40 pounds. Couldn't figure it out, of course, because of COVID. Everybody thought it was COVID right to begin with. So difficult, strung out for 6 months, and ended up having a colonoscopy, which is something that we offer to most individuals over 45 years old, but most people are very hesitant because, nobody wants to have that procedure. But it is what found the cancer, and what I was able to do is keep on having more surgeries to cut off the cancerous cells and part of my colon, and it has a pretty good success rate if caught early, and that's kind of one of those keys, right, for the education and coming in and getting screenings, is to prevent those kind of things. And I'm just about 50 years old, so I wouldn't have had one to begin with. So it actually worked out that, the right doctor told me the right things, and I followed directions.
But Doc, you do not look a day over 40. You said that you're 50, but I don't believe you. I'm so sorry. But I guess to entice more of our island residents to come and have things like cancer, especially cancer or other infectious diseases screened, what would be the best course of action? Would it be to talk to their doctor right away, or just to sort of...
Yeah. So if they don't have a primary care provider, what I recommend is coming in and establishing care with a primary provider, whether it be me or someone else, or even, just anywhere. Establish with somebody who you're going to trust and have a good relationship. Of course, we want you to come here to IHP, right? And be able to be honest and open about all the different symptoms that you've had or any concerns that you have, and then let us do some lab work. And coming in every year is very important to be able to prevent that.
All right, Doc, and to close everything out, is there anything more you would like to say?
No, but thank you so much for having me. I appreciate it.
All right, guys, don't go anywhere. We'll be back with more health, home, and lifestyle.